Today, we're back with Unintended Consequences, Episode 55. It's July 11th, 2026. Today's case is a reminder that complex systems rarely respond the way we expect them to. In 1992, the United States Department of Agriculture unveiled its Food Guide Pyramid. The diagram showed a broad base recommending 6 to 11 daily servings of bread, cereal, rice, and pasta, with progressively narrower tiers above it for fruits and vegetables, then dairy and protein, and finally a small tip for fats and oils. The intent was to give households a single, memorable visual that would steer everyday choices toward eating patterns researchers had already linked to lower rates of coronary heart disease. Within roughly a decade, national food supply data recorded a clear drop in the share of calories coming from fat, yet measured body weight and new diagnoses of type 2 diabetes both climbed steeply across the same period. The chain of decisions began with the 1,977 dietary goals for the United States, drafted by the Senate Select Committee on Nutrition and Human Needs under Senator George McGovern. Committee staff examined the sharp post-war rise in coronary heart disease deaths and turned to the dominant scientific hypothesis, advanced by Ansel Keys and others, that dietary fat, especially the saturated kind, raised serum cholesterol levels and thereby increased heart attack risk. The report therefore set explicit population targets. Total fat should fall to 30% of calories and saturated fat to 10%, while carbohydrates from grains, fruits, and vegetables should rise to fill the gap. At the time, those targets matched the clinical evidence then available and also satisfied the practical need for one set of clear, nationwide numbers rather than dozens of individualized prescriptions. The 1,900 milligrams dietary guidelines for Americans and the additions that followed kept the same emphasis on lowering fat. In 1992, the USDA turned that guidance into the Visual Food Guide Pyramid, placing the grain group at the base and confining fats and oils to the narrow tip. Within months, federal nutrition programs, school lunch standards, and the training curricula used by registered dietitians had all incorporated the new diagram. Early purchase data showed modest declines in whole milk and red meat sales. The American Heart Association and leading medical journals publicly endorsed the direction. A smaller group of researchers who had spent years studying sugar metabolism pointed out that the guidelines said almost nothing about whether the carbohydrates replacing fat would be whole or refined, yet those cautions received little public attention at the time. Food manufacturers reacted to the new consumer demand for low-fat labeling by reformulating thousands of everyday products. Fat was removed from recipes and replaced, often on a gram-for-gram basis, with refined carbohydrates and added sugars chosen to keep texture, mouthfeel, and shelf life intact. Between 1977 and 1997, USDA food supply data show average daily fat intake falling by roughly 11% of total calories, while carbohydrate intake rose by a comparable share, much of it arriving in the form of high fructose corn syrup and refined wheat flour. National Health and Nutrition Examination Survey figures record adult obesity prevalence moving from 15% in 1976 to 1980 to 31% by 1999 to 2002, with diagnosed diabetes tracing a similar upward path. Because the pyramid treated every grain serving as interchangeable and set no ceiling on total carbohydrate, shoppers could load carts with low-fat cookies, frozen dinners, and breakfast cereals, while still satisfying the visual serving counts printed on the package. Marketing language that equated low-fat with healthy reinforced the pattern, even though the guidelines themselves never made that explicit claim. A further consequence appeared in agricultural policy. Corn and soybean acreage expanded to meet the new demand for refined sweeteners and oils, which in turn lowered the relative price of those ingredients compared with whole foods. By the mid-2000s, the original pyramid faced growing criticism both inside and outside government. The 2005 revision added a stick figure climber to represent exercise and began to distinguish whole grains from refined ones, yet it kept the broad carbohydrate base in place. In 2011, the USDA replaced the pyramid altogether with MyPlate, which reduced the visual size of the grain section and dropped the explicit 6 to 11 serving range. Current dietary guidelines still advise limiting saturated fat while giving more weight to overall dietary patterns rather than single nutrient targets. Obesity and diabetes rates have not contributed, and researchers continue to debate how much of the rise traces to the fat reduction message versus simultaneous shifts in physical activity, sleep patterns, and the wider food environment. No formal recall of the earlier advice ever occurred. The change has been incremental and remains contested. When official guidance is framed around a single macronutrient target, markets quickly optimize around that target, often by swapping one entire class of ingredients for another, without any gain in overall nutrient density. Population-level rules therefore need to anticipate the compensatory moves that both consumers and producers will make once the rule is announced. The episode also shows how visual simplicity, while helpful for communication, can hide metabolic differences among foods that sit inside the same colored tier on the diagram. How might today's single metric public health campaigns, from sodium limits to screen time caps, create similar substitution effects that only become visible years later? That's unintended consequences for today. If this episode gave you something to think about, share it with a friend who'd appreciate the story. Subscribe wherever you listen, and we'll be back tomorrow with another case. And if you'd rather watch than listen, find us on YouTube at NARA Network, links in the show notes. And before you go, this show is part of the NARA Network, a family of daily podcasts on tech, science, and markets. Each one a short, sharp briefing you can finish on the commute. If today earned its place in your feed, here's your next listen. Tesla Shorts Time, your daily deep dive into everything Tesla. Find every show free at naranetwork.com. And on the website, every episode's visuals live in our free image gallery at naranetwork.com/gallery. Royalty free under Creative Commons, download with attribution. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own.